Hey everyone, I'm back. It's been about 2 weeks since I last made a video. I'm trying to get the right angle, but anyway, I'm still new at this. But anyway, so in the last video I did infant one, how to take care of an infant, in the infant room in a daycare center. So this time I'm gonna talk about hand washing. I think hand washing is very important. I notice it doesn't happen a lot. A lot of people do not wash their hands in daycare and not the way they should. So you should always wash your hands when you before you change a baby, after you change a baby, you should wash your hands. There's so many germs in daycare. You have pink eye, hand, foot, and mouth. Stomach bugs goes around. You have what is it, RSV, um, down COVID, hand, foot, and mouth. There's so much, just so many things going around, and to protect yourself and protect the baby, wash your hands and wash the baby's hands. You can wash with soap and water. You can use a um a wipe to wipe the baby's hands, because sometimes when you change babies, they like to grab on themselves and touch themselves. So they really you need to keep their hands clean, because they will touch on themselves and they'll stick their hand in the mouth. So make sure you keep your hands clean and the baby's hands clean, after diapering, before diapering, or, just throughout the day. And when you change a baby, always wipe the mat down. The the changing pad mat, wipe that down with you should have a solution, like a spray, like bleach water solution. But make sure the baby is nowhere near you when you do this. Sit the baby on the, away from the spray. Don't don't spray the, yeah. Just do this after you change the baby. Spray the change the table down with bleaching water. That kills um diseases and infections, and it, cleans the mat. And another thing is, when you're working in daycare in the infant room, communicate with the parents. Always communicate with the parents. When they bring their child in, I'm not saying you have to hold an entire conversation for 10 minutes, but just ask them, well, when was the last time he or she ate? When was the last time they ate? Is it ready? Is your child ready for a bottle, or are they ready to have their solid foods? Just just communicate with the parents, so they will, so you could just get the routine started. Most babies are usually on the same routine, but it may change the next day, or so always communicate with the parents. Um, so let me see what else I want to talk about. You have babies that drool a lot. So for the babies that drool a lot, keep bibs on them. I don't know how many people that are watching this have worked with infants, but you have some babies that drool so much that around their neck it will start getting like bumpy and red, and because the drool, and sometimes it's because the milk, when they drink the milk, is drool. But try to keep bibs on them to kind of cut down on the red and bumpy neck, because sometimes that'll turn into, okay, I think sometimes it turns into yeast. I mean, I don't want to sound like a doctor, because I'm not. I'm just a child care worker. But sometimes that'll turn into something where they will have to go to the doctor and get some type of cream to get rid of that. So try to do what you can to prevent that. And another thing is, when you have babies, always talk to the babies. And I know you can't be in a baby face all the time, every minute of the day. So I'm not saying that. But give each child every each child in the class individual attention. It can be like for 2 minutes, at a time. You don't have to hold them for like 20 or 30 minutes, but just, you should just do this throughout the day. The children are in daycare all day. Some are in daycare from 7 to 6 or 8 to 5 or whatever. And you don't want to have a child feeling ignored, so pay attention to the babies, communicate with them, talk to them, play with them, feed them, and with for the older infants, say you have a child that's 7, 8 months, you may want to start introducing them to table foods, like little finger foods. So you want to like communicate with that with the parents too before you start feeding. Never just start feeding a child food. Don't ever introduce a baby food on your own. Like, well, I'm gonna just feed this child because you never know what parents want to do, and it's their child, so you have to kind of honor their wishes, so whenever the parents say, if they say I want to start now or later, then that's their child. So that's what you go by. um okay, so another thing is, this is not something that has to be done, but I know some centers do this. But in the infant room, if you have babies that are crawling, you don't want to wear shoes in the infant room. Just imagine you're outside, you're walking on the ground, in the grass, you're stepping in everything, and then you walk inside the baby room with your shoes on that's been outside stepping in God knows what, and the baby that's crawling on the floor is crawling where you put your foot or your shoes, and then they stick their hands in their mouth, and that's kind of disgusting. So, you know, I think, I know this is not something a teacher can do, but they might can recommend this at the center. But um, yeah, it is good to keep germs down in the baby room, and just have the parents and the teacher remove their shoes at the door. You can just keep your socks on, or if you're a teacher, you can have an extra pair of socks or something. But yeah, just keep the shoes off, and so that's another thing. Let's see. I'm trying to do better with my speaking. I know it's kind of I'm not the best speaker as far as talking, but I'm still trying to get used to everything. So, let's see. I said communicate with the parents. Just ask the parents what they like, as far as giving their child food. I did talk in the last video about changing diapers every 2 hours, and just making sure a child stays dry. You don't want to change a baby every 4 or 5 hours. I mean, because this causes diaper rash, and this leads to diaper rash can lead to yeast. I've seen babies. I have a story for everything. I have actually seen a baby, well, at least two that I can remember, that had what was considered a burn, like, I don't know if it was like first degree burn or something, but it was something on that level, because the diaper rash was so bad, like so bad, like the skin was off the child diaper area, the and it was just red. Like, there was some point where this happened. Yeah, and two that I can remember. So make sure you change the babies. And for the parents that's watching, make sure you change your babies. I know a lot of babies don't get changed every 2 hours at home, but because I've seen where the children go home for the holidays, and they're okay, then they'll come back after 5 or 6 days from being out away from the daycare, and now they have a very bad diaper rash. And so that's another thing. We have to keep the babies in dry diapers. No baby wants to have a diaper rash. And and sometimes diaper rash can also lead to like a yeast infection down there, where you have to go and get ointment from the doctor, or get a prescription to pick it up at the pharmacy. And so um I guess that's all I could think of right now. It's a whole lot more, but also when you're in the baby room, introduce tummy times to your babies. Let them be on the floor, let them crawl around, you know. Um, I think exercises are really good, but don't just have them in the exercises all day. You let them get in there, bounce around a little bit. They could grab the little toys and bounce, strengthen their leg muscles, and then take them out. Don't let them sit in there for an hour just bouncing around. Um, so I think that's about it. Talk to the parents at pickup time. Talk to the parents again. Say, tell them how the child day went. The child did this. The child did that. The child need diapers. The child need wipes. More food, more cereal, more clothes. I always told parents to keep at least 3 changes of clothes in the baby room because sometimes a baby could have like 2 blowouts in a day. So we always try to have enough clothes at the center. Even an extra pair of socks because some babies have blowouts and they will mess up their socks too. So yeah. And if their child have a lovey, especially if the child new at the daycare, tell the parent you could bring your child like a shirt with the parents sit. I've seen parents do this, or like a little lovey that they have that can comfort them until they get kind of used to the program. And this is some of the most important things I can think of. I'm sure there's more, so I will make a part 3 because I know there's more. There's a lot more. But yeah, just talk about the parents. Keep track of the diaper change. A lot of parents like to see what their child have done throughout the day, like as far as when they ate and when they changed. So kind of keep a report on the diaper changes. Cause some parents don't care. They'll get the paper and they'll ball it up. And some places don't even have the papers no more. They have the apps. They have like if we had at the center I was at, we had Hi Mama, but then they have another one called I can't think of. I think it's like called Wheel Dream Wheel something. I don't know. I think I'm getting mixed up, but um yeah, I will report about the different apps and everything in the next video. I got to kind of learn. I don't know all of them, but this is part 2 of the infant. Taking care of infant in the baby's room. Oh, another thing, when you put babies in cribs, put babies on their back. Always lay them on their back. Now, if they can flip over, that's okay. That's okay. They can flip over. But when you place them on their back. Nothing should go in a crib with a baby but the pacifier. You can put a pacifier in the crib. There shouldn't be no pillows, no boppies. There shouldn't be no lovey, no mom's favorite shirt. None of this stuff should be in the crib with the baby. It should be the baby and the passy and the sheet that's on the mattress. That's it. No sleep sacks. I don't know what DHR said about sleep sacks. I don't think they allow them. But personally, I would not put anything in a bed with a baby other than the things I mentioned. So, and the baby should be laying on it back, but if you flip over, that's fine. And so yeah, I think that's about it. Um, Another thing, one more thing before I leave. Um, Make sure you tell parents it's important babies start to crawl. I notice with a lot of babies, some parents they'll bring their infants in with long gowns, these long, like nice fancy gowns, the little girls, and it would kind of prevent them from crawling. They can't crawl because they will kind of trip and their skirt or well their dress will get caught up, when they're trying to crawl. So they're struggling to move because, the gown is in the way. So we had asked parents to stop sending their kids with these long flowing gowns. And they were pretty, but they prevented the babies from moving. And so we make sure to have the parents send their child with like comfortable clothes that allows them to move the way they should move, Um, and that's about it. So I think that's all I can have to say about this. This is part 2 of infant care in the infant room. All right, bye bye.